Everyone, this is Charles Clinton. I hope everyone's having a great day. We're gonna talk a little bit about social media and your white coat. Currently I'm a PGY2 in the States, and let's go back a little bit in time. I've graduated medicine a whole lot of years ago in my home country. I went into some residency training over there, and now I'm back at it here in the States. So basically, this is the country I come from, Costa Rica, and you can see that um, pictures over there in the clinical setting isn't anything abnormal or strange. So that was frequent as long as your patient was fine with it, and usually a verbal okay was enough. So, of course, here I covered faces because here in the US scenario it's a little bit different, so that's why we're gonna talk about it a little bit. So let's talk about this. I promise this will get back into the topic we're talking about. So central venous catheter kit fun fact. So most of you in the United States are using the Arrow kits. So as you can see right here, you have the needle attached to the syringe, and there are some patients that are very difficult that you get into the internal jugular or you're doing this central venous axis, and when you uncouple the syringe from the syringe from the needle to pass the guide wire through, you lose the axis. So I remember that in Costa Rica we also used these same kits, and with those very difficult ones, you just don't uncouple these two things. You just leave them together and you pass the guide wire through this end. That's why this has a small hole on this side. And why do you do that? Because that way you can check if you're still in the vessel. You can pull back a little bit of blood. Oh, I'm still in the vessel. Pass the wire there. If it's even more difficult, you can ask someone, put on some sterile gloves, be ready with me. I'll make sure I'm in the vessel, pass it through. Okay, that's the fun fact. Why is it a fun fact? Because in my residency program, there were people that didn't know this was a thing, didn't know that you could actually do this. So I thought, oh, this is very interesting, and I had an interesting patient with which I did this technique. You'll listen to it right here.
Disengaging the syringe.
Basically, you're listening that, yeah, you can pass it through there. You can pass it through there, and that's interesting. And as you can see, I've always liked sharing. So sharing is caring. So I've had all sorts of different social media accounts, Facebook here, YouTube, WhatsApp group chat with students without getting paid a cent, but it was pretty nice. It's always nice to pass on to others the little things you learn, or even spending some time making this video, redoing it. So here I'm showing how I made this video like 4 different times, an hour and a half to 2 hours of my life around 9 p.m. on a Sunday. And yeah, in the end I published the video for a while, then erased it because I didn't like it looking not that professional looking. So yeah, so here Instagram and all that. So sharing is caring, but you have to understand that depending on which country you're in and which institution you're working for, you have to abide to the rules. So I thought that just sharing a clip where you were just seeing the inguinal area and just seeing the drawback of blood and passing the guide wire would be okay. But remember this quote: the road to hell is paved with good intentions. So sometimes even having the best of intentions can make you get into some trouble. Okay, so you always have to know the rules. You have to know what to follow. Okay, so what is the problem for my PICO's question? So the problem is social media, right? That's the problem we're dealing with today, and I want to help you avoid digging your own hole. So thank God I didn't have to dig my own hole, but I want to try to help you out, because you can get great grades and do everything but come from Latin America and post something and end up in huge trouble without it being your intention, by you just trying to help others out. So let's avoid digging our own hole, and this is, let's dig the hole for more information and understanding. So that's what we're gonna do right now. So do we really need to define social media? No, probably not. In summary, I'll just summarize it. Any person talking to another person through an interface, digital interface, that's social media. It's not only Facebook, not only Twitter, it's also WhatsApp. It's also your SMS, your messaging carrier. All that is social media. Okay, so who is this talk for? This talk is for anyone that is in the medical field, nurse, student, medical or doctor, right? Respiratory therapist, anyone that is in the medical field and seeing patients. Okay, because, and if you have a smartphone. So basically, I didn't even mention that because it's pretty weird that you're in a hospital nowadays working without a hospital. That it's very, in the United States, that's probably unheard of because that's how they contact you. But in other places, it might still be a thing. Okay, so this is a nice article I found from 2017, a questionnaire done in Corpus Christi Medical Center, Texas. This was, of course, it has its limitations and everything. It's a survey, and the survey was not the best of surveys, but it gets to several different questions which are pretty good, and I believe they make a good job at doing, and the sample size is enough for us to get some sort of statistical significance. But in general, the gist of it is, yeah, understand that if you're less than 40, you probably use social media way more than if you're over 40. That's why you'll see all of the percentages in the less than 40 area way higher than the more than 40. And you'll see also statistical significance, meaning there's a difference between both age groups. But nonetheless, everyone is using social media. Well, in this survey, 84% of those above 40 years of age, which of course you, the viewer, probably would understand that, it's higher, it's probably higher, but okay. And let's see what else is important. Do you use social media before going to bed? Yeah, basically a lot of people do, but look at the difference. If you're above 40, yeah, you might go to sleep without having to go through Instagram and all that, but if you're less than 40, you'll go into some sort of social media account, right? So basically, social media is part of us, and since the appearance of these phones, we can already say that social media had begun. So even these phones, messaging someone else with those QWERTY keyboards, that was already the origin of social media. Of course, not as complex as we know it. So imagine that MySpace, this has happened in a very short period of time. So as you see this video in August 2023, if you see this some years from now, you probably will be able to talk to your artificial intelligence verbally and get responses back in real time. Well, right now you have to text and you'll receive text back, but of course this is growing exponentially, so it's very difficult to stay out of the social media environment, of course, because it's ingrained in all our civilization nowadays. So look at this, 1,400% increase, so 14-time increase in the usage of social media in between 2005 and 2020. Why? Because millennials overtook already the baby boomers as America's largest generation. So everyone's using social media. No man is an island entire of itself. Every man is a piece of the continent. And there you have the matrix going on. So all of us are connected in this digital thing going on. Okay, so let's determine the question. So now we know that social media is everywhere. Now the question is, what do we do with social media? So this is another article explicitly saying that most people, most doctors or most nurses do not know what their institutional policies regarding social media is, basically. So yeah, so it's important that we know this because that can affect professionalism and it can even affect your future. So most large number of workers are unaware of the social media policy. So that's true for me as well. And of course, let's look a little bit more about this survey that was done. So basically, are you aware of your social media policy? So there's a big difference between registered nurses and MDs. As you can see, registered nurses, about 72% knew about their policies, while doctors, only 38% knew. What's the reason for this? I'm not sure, but you can maybe assume that, I'm not sure. Maybe the nurse is way more time than the doctor is with the patient, physically with the patient. And probably that can lead to way more interaction and way more possibilities of you being on the phone and complications happening secondary to the use of social media and more communication about it. And I don't know. I don't know. But the thing is that even the 70% survey answering here that they are aware, even that there's at least 30% of people who don't know. And look at the MD section, most people don't know about their social media policy. Okay, so the PCOS question, here you have it. Of course, this is a different PCOS. It's a little bit more limited because yeah, we have to look for descriptive things. There is no clear comparison. It's not like you can go into a hospital and make a RCT where this group of doctors will not use social media and this group will for 5 weeks, and you cannot use social media at home and or a phone at home, and this group can. So it's impossible, right? So you have to go through descriptive things. Okay, type of question basically is the prevention of self-harm, right? Auto-inflicted, maybe not conscious harm by the use of social media and harming your patient. Basically, type of article, anything we can find under the term social media. So I didn't only use the term social media, I used because I saw that there are other wording for this same term, such as digital media or electronic communication. But basically, social media is the main term used nowadays. Okay. So some sources I searched, of course, I asked my faculty, I asked specialized department of the hospital pertaining patient privacy, and actually I didn't get all the responses, and that's part of why I had to go look under the rocks right here and go into the internet and look all over. So going back to 1996, when the CDC and the HHS first said something about this, about patient privacy. Yeah, okay. HIPAA, right? HIPAA, which they actually, I think it's written incorrectly. We'll see it later on. But I always get mixed up, so pardon me on that. That means health information, protected. Well, we'll see it soon. Okay, basically it's the personal patient's information protected information act. We'll see it in a second soon. Maybe here it is explained. No, it's not. So basically, why did we go back to 1996? To see if there was any mention of social media or digital media. Of course there wasn't, because 1996, this was what just starting. MySpace initiated in 2003, so yeah, there was no mention of it. So this is me just scrolling through the whole document looking for social media. Yeah, I didn't find an answer. Of course, there was a black hole to be found elsewhere, right? To be filled elsewhere. So the American Medical Association did have some information. Now let's go to the year 2011. So now you have MySpace. Now I think Facebook has already started. So now you can think about social media. And actually in 2011, this report, the Council on Ethical and Judicial Affairs, did Well, it looks like something that will give us an answer. Professionalism in the use of social media. So I was looking forward to reading through this article, but actually it just gave us a glimpse into it. Just said that there was the need to answer the question on how to use online social media professionally. And here they just mentioned this over and over again. That, for example, here concerns have been raised regarding blurred boundaries of patient-physician relationship and the impact of unprofessional behavior by physicians online to the profession as a whole. So it's basically saying, yeah, there's a need to answer this, but the title was a little bit, yeah, it was a little bit unclear, right? Because we were expecting answers, and basically what it did was explain what social media was and what were their different modalities, and also stated that, of course, in the age of social media, in the past, the spark plug or just talking about a patient usually would diffuse information slower because it would be in the setting maybe of an elevator, while in these days, of course, social media will get to millions of people. So now it's more risky, right? Everything is magnified, multiplied, the goods and the bads. Okay, so we went and saw a little bit more about this council, what they talked about, and it's basically making some good pointers here that the physician must seek to protect patient privacy, that the privacy isn't only physical, it's informational, it's decisional, and associational. Okay, so protect patients' privacy in general. And a nice phrase that I took from this, reading through this, is respecting the patient's autonomy builds trust. And how do you respect patient's autonomy? Yeah, you have to protect their privacy first. That's one of the things you could do. So, confidentiality. The physician should not reveal confidential information without the express consent of the patient. Okay, at least they're trying to state something there. And they also stated that the use of social media is not only that you can't do it. Yeah, you can do it, and it's actually beneficial in some circumstances. Which are the circumstances where it can be beneficial? It could be beneficial if you are spreading information on how to bring consciousness or awareness about an infrequent disorder. So you might be able to help a patient later on, in the future. Okay, sometimes humor in a serious and high pressure experience may serve coping and stress relief functions. So in the ethical analysis of social media in these years 2011, that still social media wasn't so diffusely spread, they were saying yes, it also is beneficial, but use it carefully. Okay, so of course there are very clear unethical uses, such as violating patient privacy or confidentiality and sexual interactions with current patients. And there are some gray zones, such as the patient that it tells you, if you ask them, are you a smoker, and the patient tells you, no, I'm not, and then you go search them up on Facebook and you can see them smoking, and you bring it up on their next appointment, that is a gray zone because the patient didn't give you the information, but you went searching into some public information they had on social media, but they weren't explicitly sharing with you. So yeah, it's a gray zone. It's also a little bit weird, but okay, understand that there are some gray zones. Something maybe more relevant as a gray zone is some, if you have a social media account and you have some inebriated pictures or sexually suggestive material in your personal account, yeah, you're a doctor, but this is your personal account and you're drunk. So yeah, your patients, if they get to it, they could be like, what do I make out of this? He's my doctor, but yeah, that's his personal life, but I don't like seeing this from my doctor. So that's a gray zone, right? Of course, if you're Dr. Such and such and you're inebriated, that's not a gray zone. That's purely awful. So I went to the back to the American Medical Association page, and here we have the HIPAA, right? Here it's, yeah, HIPAA with one P, A. It was correct in the first place. I'm sorry. So it means Health Insurance Portability and Accountability Act of 1996, which is the first resource we saw a while ago. And yeah, this is the main document where all these patient rights stem from, which are in essence very good for the patient. Okay, so here you can see me scrolling down through the HIPAA. How can I get to social media and how do we use social media? And I found a link there that said tips for physicians at the bottom of the page, and that's what we're opening right here. So as you can see right here, we have the tips for physicians. It doesn't have much information, nothing clear cut on the use of social media, but at least we can see 3 core compliances, which is the privacy rule, which basically says, yeah, you have to respect the patient's PHI or HPI, but PHI is protected health information. I've heard other people say it HPI as health protected information. But yeah, understand it's protected information. It is private. Then you have to maintain it secure. You can't just go sharing it with everyone, that even in the hospital, if they don't have to know about it. And the breach notification rule is basically if you breached these previous 2 rules, you should notify the Secretary of the U.S. Department of Health and Human Services, HHS, and in some cases the media. So I hope that doesn't happen to anyone here, and it might be overkill, but maybe there are some instances that it should happen, okay? But this article didn't mention social media at all. So then I went to the ACP to see what information they had. I went specifically to the 7th edition of their Physician Ethics Manual, which is the latest edition. It's published in fairly recently, well, 2019. And some changes from the previous manual is that in this occasion, box number 1, they showed here social media and online professionalism. Once again, I thought, okay, they're gonna give us clear-cut recommendations. Once again, this is the only thing they mentioned about social media. Just pause before posting to reflect upon the public and colleagues might think about the online content. Be cognizant of the privacy settings for secure messaging and recording of patient-physician interactions as online networks and media. That's it. So then I went to the HHS, which is the Health and Human Services, which is also one of those big institutions concerning patient privacy. And I searched special topics tab, frequently asked questions. I searched for the answer for guidelines on social media use in our environment. No answer whatsoever. So I'm looking for the answer, no answer. And over there in the horizon, what we can see is this small article that we have to try to read, can't read it. And here we have, this is the article, Social Media Guidelines, a review for health professionals and faculty members. Wow. Did I hit the jackpot? The answer is not sure. Why is that the answer? Because yeah, the title seems great. The job they did is pretty good, but who published this? This was mainly students. So yeah, it's a good publication, but it's students and it hasn't been published in one of these big impact factor journals. So yeah, take it with a grain of salt, right? So here we have it, the methods they went through, the 9 guidance documents by medical governing bodies in major international English-speaking countries. So this isn't just the United States. So how can you apply it just to the United States? Don't know. So the conclusions of this article, making it short, is the guidelines predominantly focus on the risk of using social media and does not explore potential uses in healthcare education and practice. All of them encourage the use of social media, so patient engagement and networking with colleagues. And there is very scarce practical guidance on how to use social media as a health professional. As a result, the article offered practical advice. This I really liked from the article for physicians and faculty members on how to run wish to run development sessions on how to use social media for professional purposes. And this little table right here is the one I'm mentioning. So it shows five different bubbles. Four of these different bubbles can get you in harm's way. And this last one is basically the positive use of social media. So understand that there are several downsides if you use it incorrectly, but this right here is saying, yeah, there are also positives. So you have to be very careful, right? While you navigate through social media, having a white coat, it's a minefield, right? So it's better that you probably listened a little bit of what we're talking about, because it could help you out in the future. But I'm sorry, we don't have that clear-cut recommendations as you are seeing. So yeah, accountability and responsibility to maintain public's trust in the profession, and it explains some things to pay attention to. Then you have this other bubble that says warning that expected privacy and anonymity is not guaranteed. Yeah, of course, understand that you cannot, even if you think you're anonymous on social media, it might not happen, and usually doesn't happen. This is an encouraging reasons to use social media, and that's important. It has to go on, and yeah. And defamation of patients, colleagues, and products, horrible. Losing titles, going to court, etc. And also confidentiality of patient information. Yeah, we've stressed that enough by now. Although there is no clear-cut guidance, we have to protect the patient's protected health information. Okay, so basically this lecture could have ended here, but I usually try to get to those diamonds right over here, so we continue doing that. And yeah, being in an HCA institution with over 50 hours of these health streams already completed, which the health streams for people that aren't in the HCA community are the preparation tools that will enable you to better perform your job in the hospital. So they are online tools, videos, questionnaires, articles, documents. So I already had completed about 50 hours of these, and of course working a full job while also learning through residency and completing these health streams sometimes makes it difficult for you to really make the best of all these different educational instruments or tools. So one of these different health streams I completed, and it was called Social Media Best Practices. I didn't even remember I had done this in one of my health streams. I already had 50 hours of these in my computer completed in about less than 6 months, and I didn't even remember this. And in the end, I'm thinking to myself and asking to myself, where else can I look for this information? I asked several people from the workplace, and no one knew of clear-cut guidelines. So I went through this one, and actually it wasn't that helpful initially, because it was talking more about growth of the program's social media account. And I was like, no, I'm asking for my personal use. I'm not asking about the program's use. So then if you continue doing that PowerPoint presentation, it has a small link there that, of course, as you know, oftentimes you're completing these things, doing other things at the same time. You usually don't click all the links you find in every single document, right? So this time I clicked on all the links, and initially this popped out, and I wasn't able to open it several times, and eventually I was able to open it. What happened on my first pass, when I was just going through this passively, not actively searching for this information, this is what happened. In the context of social media, our attention span fell from 12 seconds in the 2000s to 8.25 seconds in 2015. Now we're 2023, so now our attention span probably is shorter than a goldfish, because the goldfish attention span is 8.25 seconds, and the goldfish is amused at looking at me. Hi, goldfish. Okay, so these are the main articles we have from opening that link. So it took us to this rabbit hole. Here you have us in the rabbit hole going through these different links. And actually, this is the best guideline we have from my personal workplace. And this is what I should have seen all along. And that's it. And probably wouldn't have ended up making this presentation. The reason I'm making this presentation is also to stress how difficult it is in this digital age to find the information you're looking for, because there's too much information. Most of the information doesn't work, and the little information that works, sometimes it's almost impossible to get to. So, well, we hit the jackpot here. And of course, it defines social media. We already defined it in summary, just using the interface to communicate with someone. That's social media. And some of the main pointers we have is that the use of social media in the workplace should be infrequent and brief, must not interfere with or detract from a colleague's responsible performance of his or her job duties. You must not disclose patient information or confidential, proprietary, or otherwise sensitive company information. So in this case, you shouldn't be disclosing, very personal, proprietary company's information. You shouldn't be malicious, defamatory, obscene, threatening, or reflect negatively on the company. Okay, even that, you have to be, even if you have negative thoughts about the company, you have to be neutral. Okay, so those are the guidelines, part of the guidelines. So this is interesting. It says a colleague who chooses to engage in personal use of social media when on working time or using a company provided device. For example, I have a work phone that is provided by the company, so must understand that because the company is facilitating their use of social media, the company may monitor any and all such use and may discipline the employee for social media use that violates these guidelines. So these are things that I read, but I have no idea, because on my work phone, I have no social media account. Oh, actually I do. We already talked about any messaging is social media. So I do have the proprietary social media app. I do message with people about patient information. And what does that mean? That anything I have on that phone, it can be actively checked? Well, it appears so, right? Can they do it? I have no idea, but this is very interesting. So that's why you can see this, you're being recorded. So the company reserves the right at any time and without prior notice to examine files, documents, personal file directories, hard disk drives, electronic communications, or any other information stored on company IT systems. Watch out, be very careful. Okay, so it's very important, this what is mentioned here that says I'm gonna be here between my two friends. It says personal use of social media when on personal time and using personal devices. So you have to make a distinction between you as an individual and you as an HCA healthcare colleague. So right here, you are the HCA healthcare colleague or wherever you're working at, right? And right here, you are out riding your bike, okay, looking cool and everything. So don't take your badge with you. Don't place your logo from your workplace on your bike suit, okay? That's you. That's your personal life. Don't do that. You can give some medical recommendation if someone falls down, but don't act as if you're a spokesperson for the hospital unless you're officially one, because you can get into trouble. So make that distinction. Let's continue. Here, have a disclaimer. This is a recommendation based on what I'm reading. So if you have identified yourself as a colleague of the company, it means trouble, because if you mention on your Instagram page, for example, the resident PGY such of this and this hospital, and then on that same page you're posting stories talking about dietary salt recommendations, someone might say, hey, I followed his recommendations, and he has on his profile, his bio, that he's from your hospital, he works with you, and this is what happened to me. And he should have told us that those aren't the views of your hospital. Oh, that's gonna generate problems, right? So you shouldn't identify yourself as a colleague of the company to avoid problems. But if you do so, you have to be very careful. So that's why, when disclaimer right here, when you identify yourself as a colleague of the company, some readers may view you as a spokesperson. So what I would recommend you is mention my views are my own. A disclaimer in your Twitter and your Instagram and whatever account you have, saying yes, my views are your own. And that's the real deal, because how will you know what are the company's views if you're not an official spokesperson for the company or hospital? It's impossible. So your views are your own views, and that can save you from some trouble. Okay. Then we have here that testimonials authored by patients may not be repurposed or requoted without the patient's express written authorization. Okay, that's interesting, because this is basically saying that you could even have a limitation as a resident going to the ICU. Let's say your patient is in the wards and your patient has, you're concerned the patient has acute chest syndrome, and you want to comment the patient in the ICU for exchange transfusion. But this could be a problem, because the patient could say, no, I don't want you to share my information with, or the patient could just let you, and you could go present the patient in the ICU, and afterwards the patient could call their lawyer and tell them, no one asked me if I was okay with them sharing my information. And so that might complicate things, right? So remember that always these laws are very difficult to interpret. Of course, you have to analyze on your own, and there are things that make sense, some things that do not make sense. But in general, in this case, don't share personal patient information with anyone that shouldn't know about it. So of course, when you go home, don't share it with anyone. When you're in the hospital and you have to go take a second look of a chest x-ray, yeah, you can tell the radiologist, hey, we wanted you to see this image again because the patient is having such this and that, and we wanted to know your opinion. Okay. If you, in grand rounds, you have to share the patient's information, yeah, do it, but do it de-identified. Okay, do it de-identified, and even that could maybe bring you some trouble, because here it says cannot be repurposed or requoted without express written authorization. So yeah, just be able to navigate things the wisest you can. And workplace pics and videos. No photos, this is verbatim, no photos showing patients, family members, or showing protected health information may be posted without a signed company-approved consent. Colleagues should ask permission before posting photos of co-workers. So, okay, be very careful with pictures in the workplace. Why? Because a simple picture where you think everything is fine, we're in our lunch hour, and you have 3 different colleagues, and then they might go talk to your boss and tell them, like, he didn't ask me for consent for him posting my picture online. I didn't want my picture online. And even this picture, which in essence would have been pretty benign, could end up having you in trouble, because this co-worker didn't explicitly give you consent. And you can say, yeah, he said he was even smiling, look at him, blah blah. He can say, where's my written consent? Oh man. So it's complicated, right? So be careful. And this one right here, the media. If the media contacts you because they want to know about such and such information from a patient, don't dress up like this guy right here. Don't put on your gel and everything and smile on the cameras, because yeah, you'll smile and you'll be on the news, but that's the last news you'll have from the hospital, right? So you'll be thrown out of the hospital if you aren't officially given the green light by the Marketing and Corporate Affairs Department. So make sure, if you're talking, have the green light by your superiors. And just to finish, thank you for your time. And the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. Sir William Osler, such a great doctor, and he's left so much for the medical field as a whole. So if you have any questions, ask the HCA Healthcare Social if you're part of the HCA. If not, ask your personal wherever you work at, right? And once again, these views are my own views. I'm not giving any views corresponding to any official entity. So that's my disclaimer right there, which you'll also see my disclaimer if I post this video. So we apply what we've learned here. And this is the bibliography. If you want to check out any of these different documents, there they are. If I could say in order of priority. So thank you very much for your time. Have a great day. See you in the next one.